Well, if you're suffering with pain and quality of life is a problem, our next guest says you don't have to live like that anymore. I'm very excited. I want you to meet Dr. Jane Hendricks. She's owner of Stem Cell for Life. Welcome to Sonora Living.
Thank you.
I have so many questions for you. Okay. First of all, I want to talk about you. How long have you been doing this?
I've been practicing medicine for 22 years.
Wow.
I started administering stem cells in 2017, both intravenous and into joints.
Okay. Well, let's talk about stem cells. And we hear about it a lot, right, for pain. So what kind of conditions do you treat?
It's the same conditions I've been treating this whole time for 22 years. Autoimmune conditions respond great to stem cell therapy, joint arthritis. So when you think of Crohn's, ulcerative colitis, I was a COVID frontline doctor. Now I'm treating long COVID. That responds wonderfully to stem cell therapy, as well as cardiovascular conditions such as heart disease and diabetes.
I did not know
Very
that.
wide range, yes.
Right. I was thinking, you know, it's in the joint and, you know, that kind of pain.
IV. Wide variety of stem
I had no
conditions.
idea.
Yeah.
All right, let's talk about the type of stem cells, right? Because here's where the education part comes in, and you guys are going to love this. So we Google it, we look it up, and we get all kinds of information. What kind of therapy do you do?
So I use the umbilical cord derived mesenchymal stem cells.
Okay.
Most patients are aware of the adipose and bone marrow, which comes from their bodies. But in the last 5 to 6 years, the market has become very saturated with the umbilical cord derived stem cells, both the distributor side and the clinic side.
I did
so
not
it's very
know that.
popular.
Okay, but stem cells are not all created equally,
Correct.
right? And
Yes.
you're very passionate about this.
Yes.
So what are some of the things that you want your patients to know about your type of treatment with stem cells?
It's the same things that I want to know from the sales rep that's selling it to me. So the questions that I'm asking them: show me the certificate, the viability of the stem cells. The patients should be asking the same questions of the doctor, of the product itself.
Really?
Yes, the viability, number of stem cells, where did it come from? Did it come from overseas? Is the clinic buying the tissue and doing it themselves? Is it coming from an FDA registered lab? And that's what I've been using this whole time from the very beginning.
Okay, and does that make a difference in the longevity of the treatment?
It makes a difference in the quality and the longevity, absolutely. I just spoke to a patient yesterday and he's like going for his 6th treatment. My patients do well on maybe 1, maybe max 2 IVs.
Really?
For years.
Really?
Yeah, so it does make a difference.
Does it depend on the type of condition that you're treating?
It depends on how advanced the condition is, how long the patient waited. So like in any medical therapy, it's always better to do it early, especially in the area of prevention or alternative medicine.
Right.
Let's start treating early on.
Do you work in conjunction with other types of therapies?
Yeah, so I'm a full service clinic, and that's another really good question. I hear about clinics sending nurse practitioners to your home to do a mobile IV, and there's no follow-up. You're sent back to your specialist. I've been treating autoimmune conditions for 22 years, long before stem cells came onto the scene.
Wow.
I'm a full service clinic. We offer frequency medicine. I'm guiding you on supplements and diet. So I'm following each patient for 6 months for just one treatment.
Wow.
If you get 2 treatments, I'm following you for a year.
Wow.
Yes.
Wow.
Yeah,
okay. And I'm guessing all of that comes into play when you have that consultation. You will determine how many treatments we need, what kind of follow-up we need to do, because it sounds like you're in it for the long haul.
Yeah, so patients should ask how many stem cells they're getting. The FDA trials is not number of treatments like chiropractic visits. It's the number of stem cells for this medical condition, and that's one of the questions the patients need to ask the clinics.
Oh my
Very
gosh. See,
important.
I told you she was full of information.
Yes.
All right. Google, she's Google right now when it comes to stem cells. Dr. Hendricks, thank you so much.
You're welcome.
Really, really good information.